The heart is the primary organ of the cardiovascular system. It is a beating muscle that supplies the body's cells with oxygen and nutrient-rich blood. The heart also requires these substances to function. The coronary arteries surrounding the heart keep it nourished with blood. Inside a healthy artery, red blood cells and other substances can flow freely to the heart. The walls of the artery are smooth and uniform in thickness. Over time, however, fatty deposits called plaque can build up within the artery walls. Plaque may harden and cause the artery to become narrow, a process called atherosclerosis. When atherosclerosis occurs in the coronary arteries, the condition is called coronary artery disease, or CAD. Untreated, coronary artery disease usually worsens and can lead to myocardial infarction, the medical term for heart attack. A heart attack occurs when a blockage in a coronary artery deprives the heart of blood. Most heart attacks are caused by blood clots that form in an area of unstable plaque. Plaque is considered unstable if its calcified cap is thin and vulnerable to rupture. A rupture exposes the fatty core to the bloodstream. The exposed core triggers the blood to coagulate or clump together, similar to the way blood clots at the site of a wound to stem bleeding. Inside an artery, a blood clot, called a thrombus, can block blood flow to the heart. Deprived of oxygen, heart tissue fed by the blocked artery will quickly die. The extent of damage sustained by the heart depends on the severity of the attack, speed of medical treatment, and the location of the blockage. The heart is a beating muscle that continually pumps blood to the rest of the body. The coronary arteries supply the heart itself with the necessary oxygen and nutrients it needs to function effectively. Over time, and for a variety of reasons, fatty deposits called plaque can build up inside the arteries, clogging the passages and reducing their size. This buildup compromises the ability of the arteries to deliver oxygen and nutrients to the heart. Plaque buildup can occur in peripheral arteries as well, a condition known as peripheral artery disease. Atherectomy opens peripheral and coronary arteries by grinding or cutting away the plaque. A guide wire is inserted into the femoral artery through an incision made in the upper thigh and threaded to the site of the blockage. A catheter tipped with a specialized blade is inserted along the guide wire. Rotational atherectomy, also called rotablator, is the most common type of atherectomy performed. A catheter tipped with a diamond burr is guided to the blockage. Spinning at high speeds, the burr grinds the hardened plaque into small particles that can move safely through the circulatory system and out of the body. Directional atherectomy is designed to remove non-calcified plaque. After catheter insertion, a balloon inflates, pushing the blade toward the plaque. The blade cuts away the plaque and stores it in a chamber. The balloon deflates and the plaque is removed when the catheter is withdrawn. A transluminal extraction catheter uses spinning blades to cut away plaque. The particles are sucked into a tube through a vacuum and expelled from the body. Transluminal extraction is often used in bypassed graft arteries. The heart is a beating muscle that continually pumps blood to the rest of the body. The coronary arteries supply the heart itself with the necessary oxygen and nutrients it needs to function effectively. Over time, fatty deposits called plaque can build up inside the arteries, clogging the passages. This buildup compromises the ability of the arteries to deliver oxygen and nutrients to the heart. A balloon angioplasty may be performed to open the narrowed arteries. A small incision is made in the thigh, and a guide wire is inserted into the femoral artery and threaded to the site of the blockage. A catheter, holding a deflated balloon, is then guided to the blockage. The balloon is inflated, compressing the plaque and enlarging the opening of the artery. This allows blood to flow normally. The procedure may be repeated if the plaque buildup returns. Following angioplasty, a stent may be inserted to prevent the artery from reclosing. A stent is a wire mesh tube mounted on a deflated balloon catheter. The catheter is guided to the blockage site and inflated. The stent expands and adheres to the artery wall. The catheter and guide wire are removed and the stent remains in place. The heart is a beating muscle that pumps oxygen-rich blood to the body cells. The coronary arteries supply the heart itself with the blood it needs to function effectively. Coronary means crown. The arteries crown or surround the heart muscles. If the coronary arteries become narrowed or blocked due to the fatty buildup called plaque, the flow of blood to certain parts of the heart can decrease or stop. When this happens, it causes the cells in that region to die and leaves the heart without the proper amount of blood it needs to function. Coronary artery bypass surgery, also called CABG, is commonly performed to reroute the flow of blood around the blockage. In traditional bypass surgery, the chest is opened and the heart temporarily stopped to allow the surgeon to perform the bypass. Traditional bypass surgery requires the use of a heart-lung machine, which infuses the patient's blood with oxygen and pumps it back into the body during the procedure. In some patients, however, surgeons may perform bypass operations without stopping the heart and without using a heart-lung machine. These procedures are called beating heart operations. In both traditional and beating heart procedures, the surgeon attaches a blood vessel from the aorta to a point below the blocked artery. The saphenous vein in the leg is often used for the bypass. In the past, an incision running almost the length of the leg was required to harvest this blood vessel. Today, a technique called endoscopic vein harvesting enables the surgeon to harvest the vessel through 1 to 3 small incisions. Medical advances, such as beating heart surgery and endoscopic vein harvesting, are making bypass surgery a less traumatic and less painful procedure for thousands of people every year.